most of you know, I love the Peak Away Resolve facial treatments that I get here with Candela Medical, but I've been hearing really great things about a treatment called Nordlys Light and Bright, also here with Candela, but apparently really good for things like redness, pigmentation, overall skin rejuvenation. So I'm thinking that's going to be a really good treatment for a lot of you who have been asking for recommendations. So I'm back at head office. I've got Kirsten Keisha with me, clinical educator here at Candela, and she's going to answer all of my questions. I have heard such good things about Nordlys Light and Bright, so what is it and what does it do?
Nordlys Light and Bright is a treatment that we do by utilising two of the applicators of our Nordlys platform. And we will start by using one of the IPL applicators depending on the Fitzpatrick skin type of our patient. So we have 3 IPL applicators that use the narrowband technology with a square pulse, which means that we're delivering light in a spectrum, a band of light. So the one I'm going to be using today is our VL555 because we have Fitzpatrick skin type 3, which means her pigment is a little bit darker than, say, mine. The second pass is going to be using the Frax 1550, and that's going to target her fine lines, which was her main concern. So in combination, we will be targeting the pigmentation with the IPL, and then we're going to be targeting the fine lines with the Frax. And that is going to end up stimulating the fibroblast cells, so she's going to have better collagen, regeneration of elastin, hyaluronic acid, and just a general rejuvenation of her skin. And the combination of the two is why we call it light and bright, because we even out the tone as well as the texture.
And who would you recommend the Light and Bright treatment to?
The light and bright treatment is recommended for anybody really that has a combination of pigmentation or vascular lesions that they want to have removed, and also some lines, wrinkles, if there's a scar, whether that scar is from acne or whether it's a surgical scar, we can also treat those types of indications as well.
And what does a client need to do pre-treatment? How do they prepare for Light and Bright?
Well, most importantly, again, we need to stay out of the sun for a minimum of 2 to 4 weeks, and use a really good skincare regime as well, which is recommended, a good exfoliant, a cleanser, a sunscreen. And if you have a darker skin, we do recommend that you use tyrosinase inhibitors, something that will prevent the melanocyte from producing too much melanin prior to the treatment. And also some really good hydrating ingredients as well, because the more hydrated the skin, the better the treatment results.
So what should we expect in the treatment room?
Well, I do like to use a little bit of topical numbing cream so that when we're doing the Frax side of things, it is more comfortable for them. The treatment in total takes about 45 minutes, so it's not too long, so it's not very uncomfortable. We do a little bit of post-cooling, then we apply some post-laser care and some sunscreen. So in total, you're probably looking at about an hour if you were doing the whole treatment in the clinic. I'm going to put some protective eyewear on you, so your eyes are going to be completely safe, rest assured. You may see some bright light though when I'm using the IPL, or you will see some bright light. IPL light is really bright because it's intense pulse light, and the wavelengths that we're using start at a certain wavelength and finish at another one. So in other words, you've got a range of wavelengths that are creating all that light. Okay, so I've done her left side of her face with the first part of the light and bright treatment using the IPL applicator. And it's the optical light that's being absorbed by the pigment in her skin. And because we use narrowband technology, meaning that we have very short band of wavelengths, blocking out the shorter wavelengths and blocking out the longer wavelengths that are absorbed by the water in the skin, we are able to do a very comfortable treatment. As you can see, there's not much erythema because it's not causing any heat in the tissue. It's not being absorbed by the water in the dermis. Have a look at what it's done to the vessels on the side of her nose. It's really darkened them, so that means that they've been damaged, they're swollen. If you compare it to the other side of her nose, you'll see that they're not as dark. So yeah, you can really see that it's worked on that. Okay, I'm just going to start on this side now. Okay, 3, 2, 1. And the beauty of using an IPL applicator is that it treats all different colours as well, so your reds and your browns, and you can do multiple passes, especially if you're starting off on the lower side of the energy, which I am at the moment, because I want to make sure that I'm not over treating, and that way I can go back and do a second pass if I feel that I haven't quite achieved my end point. Okay, so now I'm going to be doing the Frax 1550. So we're doing the resurfacing component of the light and bright. So we're going to even out the texture on the surface, but also because it's a 1550 nanometer wavelength, it's going to penetrate right down into the reticular dermis and stimulate that fibroblast cell. So in about 3 months' time, she'll notice that the volume of her skin has increased as well as the luminosity, because we are also stimulating hyaluronic acid as well as collagen and elastin.
So you've sold us all on Light and Bright. What does the client need to do post-treatment in terms of aftercare?
Well, now depending on how heavy the pigment load is, we can expect some darkening, we can expect some microcrusting, and with IPL, pigment darkening does take a little bit of time. So you can expect perhaps a little bit of heat, almost like a sunburn, for about 1 to 2 hours after the treatment. So lots of cooling is a really good idea. Stay relaxed, stay indoors, stay cool, loose clothing if we're treating anywhere else on the body. On the face, we do recommend stay right out of the sun for a minimum of 2 weeks. Keep your skin well hydrated, drink lots of water. For the first 24 hours, of course, avoid excessive exercising, swimming, saunas, spas, and definitely no exfoliating until those little microcrusts are ready to come off all on their own. And it usually takes about 7 days for that to resolve, and then they can go back to using their active ingredients and of course wearing a really good sunscreen as well.
And how many treatments would you suggest that a client has to have to see really lasting results?
With Light and Bright, it's like most rejuvenating treatments, we do recommend a series of 3. Sometimes you might need more, sometimes you might get away with less, but in general, 3 treatments.